actually eating more now than before the program, and I'm losing weight, which I couldn't do.
Because of hormones.
Yeah. Yeah.
We test them, balance your hormones, and we teach you how to do that. That is such a huge part. Hey everybody, welcome. Today we're interviewing Michele, who's been dealing with symptoms of Crohn's for over 25 plus years and a lot of other mysterious symptoms, including severe joint pain. I'd love for you to introduce yourself to our audience. Tell us a little bit about you and your autoimmune journey thus far.
My name is Michele. I'm 49 years old. I have a very busy job working in commercial property management. So I'm on the go a lot. I was diagnosed with Crohn's disease about 25 years ago. So I've been dealing with that for quite a long time. And then about 10 years ago, I developed rosacea, which was also devastating. You know, you have something like that going on your face. It's really hard to deal with. And then a few years ago, I started developing a really bad joint pain, especially in my hips. And that is something that I actually, I don't have a diagnosis on that, but it's something I've been dealing with for quite some time, and it's really, really affected me.
You know, Michele, you know, that's, I think, one of the misnomers with autoimmunity that you're highlighting, which is that even though you may have one diagnosis, which is Crohn's, people don't realize with autoimmunity, just because your body mistakes one part of your body, which is your intestine, small intestine as a germ, the likelihood you can have many other parts of your body mistaken as a germ, and target of autoimmune attack is 100%. And therefore, it's 100% commonplace for someone to have one diagnosis like Crohn's and to have big hormonal problems, to have migraines, to then also have joint pain without a diagnosis, quote unquote. So, I mean, this is typical.
Yeah. Yeah, that's something I've certainly found out. And I have to be honest, I didn't want to go to the doctor for the joint pain because I knew what the answer was going to be. And that answer was going to be, okay, here's some more pills. Here's some more drugs for you to take. And I was tired of that. I felt that there had to be some other way. I was always dealing with low energy, all of the bowel problems, stomach pain. You know, it really took a toll on my life. Yeah, it was difficult.
I mean, dealing with for 25 years, was there a moment when it was a major turning point for you to really make a decision that you had to do something different about this?
I landed in the hospital with a bowel obstruction. And I was in the hospital for about 4 days, and I was absolutely terrified. I was getting pumped full of antibiotics, prednisone, everything they could do to get the inflammation down. And they told me, several doctors came in and said, you know, we truly believe you are severely undermedicated. So, you know, we really need you to go on a biologic at this point. And that's something that I had been avoiding for a couple of years. My GI doctor had been wanting me to do that for a while, and I really didn't want to. I was really afraid of the long-term effects that it could have on my body. But at that point, I didn't know what else to do. I mean, I'm in the hospital, I'm pumped with all these drugs. My husband was terrified, my family was terrified, and all of them said, look, maybe the biologic is the way to go for you at this point. So I did. I went ahead and did it. And I remember sitting there in the infusion room, just quietly crying to myself because I didn't want to do it. And, but I felt like I had no other choice at that time. And I was just so scared of what it was going to do to me long term. I had heard everything about, possibly getting cancer and, all the risks involved. Yeah. And so anyway, I did go ahead and do it. And after a couple of years of biologics, I didn't get into remission. Still didn't. So we had some further tests done, and they decided that it was time for me to go and talk to a surgeon. So I went and had a surgical consult, and he said, look, Michele, he says, the only way that you are going to have a better quality of life is to have a bowel resection. We have to start
remove
taking
body
pieces
parts
out. Yeah. And he's, explaining how painful it's going to be. And, he wasn't sugarcoating anything. It's like, you're going to have to wear a colostomy bag for a while. It's going to be 6 to 8 weeks of really feeling awful. And then, I didn't even know, there was no 100% guarantee that after this surgery, that I was going to be any better. There was no guarantee that I was going to be able to live the rest of my life without dealing with these horrible Crohn's symptoms.
The thing is that you've learned, and I keep talking about, is conventional doctors are really only trained on 2 tools, medication or surgery. That's it. And think about it, 25 years of Crohn's, what else were you offered besides those 2 things?
That was it. That was 100% it. And I do remember having a conversation with my GI doctor, trying to talk to her about food. And that I really felt that food was a problem, that it was exacerbating my symptoms, and I was trying to get to the bottom of it, and it was amazing. It was like, this blank stare would wash across her face, and she'd go, mm-hmm. There's really no connection between food and Crohn's disease. Exactly, right? That's what I was doing in my mind the whole time.
So you guys who didn't see me, I did a theoretical. Because we as sufferers of autoimmunity know food matters, and to have your doctors sit here looking at you under the glasses and be like, no, there's no connection with food and immunity, I think is downright ignoramus.
Absolutely.
They literally lack training that food matters, and they don't have themselves, so they don't know jack about being a sufferer of Crohn's. So food doesn't matter, and you're sitting here like,
Right.
So Michele, let's go back now. Now that, why did you decide, going through all this, I hear the confusion, the hell, and the option of surgery. What made you decide to join our program, which is a 2-month online program done from anywhere in the world to turn around your Crohn's and your autoimmune symptoms?
I was scrolling through Facebook one night, and your ad came up, and just out of the blue, it was transform autoimmune disease naturally. And I thought, okay, I'm in. So I joined the Facebook group, and I immediately started watching the case studies in the unit section.
Yeah.
And I thought to myself, okay, there's something to this. I listened to the whole thing, and the whole time I was like, oh my God, this is me. Oh my God, this is exactly what she's talking about. Totally relates to everything that I've been through. I left the Zoom meeting, and I turned to my husband, and he looked at me and he says, you would be crazy not to do this.
So at the 2-month mark, where are you? What's the outcome?
Oh my gosh. So I would say that overall I am at about 80% relief with my symptoms. I am no longer running to the restroom 6 or 7 times a day. So my stomach issues have really calmed down. My rosacea is, it's really clearing. And that was something I didn't even think about when I entered the program. It wasn't even on the top of my list of things I was worried about. But yeah, so less redness in my face. I am sleeping better, which was a huge deal for me. I was exhausted all the time when I came into the program. I was desperate for sleep. I was constantly waking up throughout the night, and I didn't know how to deal with it. And now I'm sleeping probably a good solid 5 hours uninterrupted at this point. And I know it's just going to get better. So that's tremendous. And also my joint pain, oh my gosh, I'm going to say about 80 to 90% gone. I am so excited about that. That was one of the biggest things that I really wanted to deal with. So I can move again. I have freedom of movement, and I can do things now that I wasn't able to do just, 10 weeks ago. So absolutely amazing. I'm getting my freedom back. I'm getting my freedom back. I'm actually eating more now than before the program, and I'm losing weight, which
That's
I
right.
couldn't do.
Because of hormones.
Yeah. Yeah.
We test and balance your hormones, and we teach you how to do that. That is such a huge part. You can't just work on just guessing on food or just food alone without balancing people's hormones and blood sugar and vitamins and nutrients and their mindset. You know, so I love the fact that we do this all at once. And I'm seeing the synergy of, like, I could avoid those foods, eat more, and balance my hormones and lose weight.
Bingo. Absolutely awesome. Priceless.
Okay, so I do want to ask one final question, kind of a personal question, you know, because you brought your husband into this as the skeptic who later was like, you'd be stupid not to do this program. I want to ask, how has your relationship with him changed as a result of you going through this program and the new outcomes in your health?
Everything is different. It's kind of like we've gone back in time, back to where we were kind of in the beginning. So it's made a huge change in my marriage. And I was afraid before I joined this program that I was going to lose it. I was really afraid that we weren't going to get a chance to grow old together. And that was, I'm going to get emotional. That was huge for me. And for both of us. So yeah, I'm in a much different place, and we are in a much different place, and I am forever grateful. Oh.
Wow, thank you.
Dr. Maggie, thank you. Thank you. Thank you. Seriously, from the bottom of my heart, thank you so much. I just said I wasn't going to cry, but anyway, I can't believe what change this has made in my life, and I'm not done yet. I'm not done yet. You know, I know I've got a long way to go, but I know how I'm going to get there. I know how I'm going to get there, and I'm so happy that I found you.
Thanks, Michele, for that amazing interview and for honestly some really vulnerable shares about how it's affected your relationship with you and your husband. I hope you guys found that helpful. And if you did, please share it with somebody with autoimmunity that could benefit from seeing this interview. They may not believe you, but they may take it from me.
Lupus, lung fibrosis, Hashimoto's thyroiditis,
fibromyalgia, AS, which is a form of arthritis.
that's too far,
extremely fatigued.
Pretty much zero joint pain.
Much more happy.
I don't have brain fog anymore.
how much weight I have lost.
I want to see remission.
Maggie and her approach is very different than the traditional doctor.
I'm a totally different person.
I got a better understanding of what those intolerances were.
You're not alone.
The community is, I'm learning from everyone else's issues.
It's not just helped me, it's helped my entire family.
We are transformed.
We are transformed.
We are transformed.
We are transformed.
We are transformed.